Hey everyone, it's Crystal. I'm a nurse practitioner here at the AAFE, and we are in the training center today with one of my patients who we are doing some lifting threads on. We're doing a 3-vector, so this is gonna help pull up her nasolabial fold, her marionette line, and then her jowl. So that is the 3-vector pulling up this way. And then this line down here, if you turn your head that way a smidge, this line right here will help to define her jawline a little bit more. It'll also help with pulling back that marionette line and the jowl as well. So we're doing the 3-vector and the jawline on both sides. Okay, so I'm just starting by dabbing the entire area. The marker we used has been cleaned and sterilized, but I always dab over one more time. She was also cleaned with HIPAA cleanse to make sure she's nice and clean before we go in there with the threads. All right, so I'm just gonna give you a little bleb of lidocaine, so a little pinch and burn. So this is 2% lidocaine. Little pinch and burn. And then I'm gonna give some down here as well. We just put it into our ComfortTox syringes, which is what we give our Botox with. It just makes it very easy for us to deliver little blebs. This is gonna keep her as comfortable as possible during the procedure. Okay, so she was just numbed with some lidocaine, so now I'm going in with an 18 gauge needle, pinching up the skin, and it's almost like I'm starting an IV, little pressure. So she was numb, so she shouldn't really feel that. She might feel a little bit of pressure just from the insertion site, but typically not any pain. And I'm just going down each of my vectors and kind of opening up that space a little bit so that my cannula can easily slip in there. How does that feel, Terry? Pretty good? All right, let me just get a piece of gauze because bleeding is inevitable in this procedure. Okay, and then I'm gonna go in with, this is a 3cc syringe that's filled with 2% lidocaine, and I have a 25 gauge, 50 millimeter length cannula on the end. So it's blunt tipped, it's not sharp. We're just gonna have that slip right into the tissue, right in that opening that I just made. And we're gonna go down each vector. You can kind of see my depth there, I'm like subdermal. And we're gonna give her lidocaine in each vector, so big burn. And it does sting. That's kind of the worst of the procedure for the patients, is that sting from the lidocaine. Last big burn. Okay, and that's the worst of it. So now she's numb, so I can go in with the threads. Okay, so the threads I'm using are 19 gauge by 100 blunt tip. So they're the Arte 2s, I believe. These are a little bit stronger. They're actually molded threads as opposed to the barb star threads that have barbs built into them. These are actually molded. So they're a little bit stronger. You can see I'm just advancing ever so slightly, just little baby bits at a time, and constantly feeling my tip, and you can see the depth of that. Just the tissue's just like a blanket over the cannula. So that looks good. And I'm all the way down into the jowl. So now I'm just gonna put gentle pressure, exaggerate that lift up as I'm pulling out the cannula, and that will engage that thread into the tissue. So the first one's in already.
Unbelievable. It really is. I mean, who would ever?
And how was it? Was that first one comfortable?
Lidocaine, yeah.
The lidocaine is the worst of it, and that's what most of our patients say. That burn is just what gets them. But after that, they're numb. Okay, so typically what I like to do is leave these 3 alone, do her jawline, and then I'm gonna sit her up and see what kind of result I got and see if I want to add any more threads. So I can fit 4 into 1 entry point. So this one only has 3 right now, so I could potentially add 1 more if I wanted. A little bit of pressure, Terry. Good. And then the jawline, I could, actually put 4 threads in there. Usually, I don't think she's really gonna need 4 in there, maybe 2, but I don't think she'll need 4. Okay, so we just went in with our 18 gauge again. She was previously numbed when I first numbed her, so now she's got an entry point, so I can slip in with the same cannula, 25 gauge, 50 millimeter length. This is a Comfort Tox micro cannula. They're really nice. Okay, that feels good. Big burn, last big burn. And again, no more than 0.5 of lidocaine in that vector. Okay, using the same kind of thread, just gonna slip in, and I'm following this jawline all the way kind of towards this marionette line. So again, just watching my depth, always checking and seeing where I'm at. And truly, when you're in the correct plane, you can see how easily it just slides. And the patient is super comfortable as well when you're in the correct plane. Okay, so we have the jawline and her 3 vectors. So now what I'm gonna do is I'm gonna sit her up before I trim, because once you trim, you can't go back in. So I'm gonna sit her up before I trim and see what kind of result I got and see if I want maybe 1 more to the jowl or 1 more to the jawline. So let's go ahead and do that. So we sat her up, and I was looking, she got an amazing result already, but I do think I just want 1 more to this jowl to really help pull it up. So I'm just gonna go right into that same vector that I've already been into and just give her 1 more, and then we'll cut. So I'm just alcoholing the outside again just to make sure she's nice and clean. And we're following the same vector we've already done, so she's already numb in that area. Don't need to add any more lidocaine. A little further, and you can see I'm all the way down here. So gentle pressure up, and that's it. So now I'm gonna take my scissors. Make sure I like to pull the threads like straight up to the sky. Open my scissors really wide and kind of follow it down. You're not gonna hurt the patient. You wanna cut as close to the skin as you can so that the thread actually slips underneath the tissue and that nothing's sticking out, so that area can heal over nicely. Same with this one, straight up to the sky, push down and trim. Just hold some pressure here. And then I just like to alcohol her face off really well again and apply Band-Aids. The entry point, I like to tell my patients, keep the Band-Aids on for 24 hours if they can. Absolutely no makeup day of procedure. They can take the Band-Aids off, you know, at night when they wash their face or whatever, or if they fall off, fine. Normal skincare is fine, just making sure that these areas are being covered and taken care of for the next 12 to 24 hours. Okay, so now we're starting the other side. So same process as before. I always like to dab with alcohol, make sure she's clean. As I stated previously, she was already cleaned with HiPAA, so this is just extra precaution. Going in with my Comfort Tox, 2% Lido, and giving her some blebs. Okay, and then same process. So going in with my 18 gauge, pinching up the skin, and like I'm starting an IV, just kind of diving in. Just going in with my cannula. Sometimes you'll struggle to get in there. I like to either pinch up the tissue and kind of dive in, or sometimes pulling it nice and taut backwards, you'll slip in that way. And then it's really easy. Once you're in that correct plane, you can see how I'm just gliding through. Some of those little resistance that I'm meeting is completely normal. If you were too superficial, you would be meeting a lot of resistance. So just kind of keep that in mind. Like if you're really struggling to get through the tissue with your cannula, you might just be too superficial. So we're using the same threads over here. You can see that I'm kind of diving a little deeper to get in, and then once I'm in there, I kind of level off because I know that I'm in the correct plane. Always checking my tip, making sure it feels good. Perfect. Okay, so just her jawline. So I already numbed down here a little bit. So a little pressure. And then again, going in with my cannula. Big burn. And then my last thread. I find the jawline easier to pull it taut back as opposed to pinching up the skin or bunching up the skin. I just feel like it's much easier and you can really stay in the correct plane. Smidge further. Okay, that's it. So then let's just cut. Okay, how was it, Terry? Did you take a little nap?
I was awake.
Okay, let's sit her up and see. Okay, so we have finished her procedure. It took about, I don't know, 30 minutes or so, so pretty quick once you kind of have the experience and the hang of it. How was it for you?
Other than the lidocaine, it was fine. It was really sort of painless, went quickly. It was very comfortable on the chair.
Good. And she looks great. So I went over some post-care with her, and she's good to go. You can see the little Band-Aids on her face. Try to keep them on for 24 hours. Other than that, she's good to go.